There are many different attitudes and opinions brought on by the implementation of evidence-based practices for substance abuse treatment. Many controversies have been documented and discovered over the course of the past few years as practitioners have begun to implement these practices for their clients. Below are the opinions of two experts in the field. Patricia Barnes believes that the best contribution to evidence-based practices for substance abuse treatment is drug and alcohol screenings, and although there are many controversies claiming it is unethical due to the violation of privacy for the clients, she is an avid supporter of it. With the application of drug screenings at primary, urgent, and emergency care facilities, when the visit there seems linked to substance abuse, there could be a significant decrease in the amount of overdoses, violence, criminal activity, and the amount of addicts whose addiction continues to grow worse. She also strongly disagrees with the treatment of prescription drugs because she believes it only leads the patient to become dependent on other forms of drugs. Behavioral assessment treatments are also considered a primary tool for Patricia. She believes that researching and applying empirically supported treatments is the future of substance abuse treatment plans. She has many peers that are skeptical about evidence-based practices for substance abuse treatment, but she believes that the meaningful outcomes in the standardized practices will make a huge difference. Our second expert is Charles Webb. He has a PhD in chemical dependency counseling and addiction studies, and he is a substance abuse coordinator. As a substance abuse coordinator, Charles's responsibility is to aid and guide new counselors in their work with clients. He relies heavily on the contributions of psychological research that has developed from evidence-based practices for substance abuse in his work, and he encourages his trainees to take full advantage of initial interventions, case treatment plans, psychosocial counseling, and pharmacotherapy when circumstances call for a high level of treatment. His work with adolescents has proved challenging but rewarding, especially as new cases from evidence-based practices are documented. Adolescents are faced with the same kinds of stress and responsibilities that can trigger substance abuse in adults, but they also face a large amount of peer pressure. Having a wide variety of treatment options to fit this for adolescents is essential for their recovery as well as maintaining their sobriety. It is imperative to find successful plans for adolescent prevention and that they will be fit for the limited resources of areas of great poverty where substance abuse is larger. Charles also believes that screening is important, but he only takes part in it if the client is willing, because he strongly believes if they are not ready to accept help, they will not be able to overcome their addiction. By accepting the vast areas of evidence-based treatments, Charles feels he has ensured that he and his coworkers will continue to have the skills and attitude necessary to help not only the adolescents they serve, but the wide variety of other clientele they will no doubt face in their future careers and experiences.